from the station that's on your side. This is Channel 7 News Daybreak.
Hey, everybody, welcome back into Channel 7 Daybreak. Today's Wellness Wednesday. Dr. David Gerson from Sherwood Family Medical Clinic joins us now with Baptist Health. And today we're talking about allergies. Dr. Gerson, an appropriate time to be talking about it this week, considering the change of the weather. And I know that every year you probably get people coming in saying, I've had allergies for a long time, I think, but I've never gotten tested. This might be the year that they might want to explain this change of seasons and how it's affecting people probably as they're watching right now.
Sure. Well, with the dramatic changes going back and forth, so a lot of times people come in and they think they actually have an infection. They have a sinus infection. They got pneumonia. When in reality, it's allergies. Now, allergies, if they get bad enough, can trigger infections later on. But 90% of the patients are coming in. It's an allergy issue. And what we find with the weather changes, especially with the fronts that keep coming back one after the other, it brings in all kinds of new flora and fauna, specifically different pollens, molds, cedars. We're seeing it all. And so right now people are symptomatic. Obviously what we like them to do is, trying to get ahead of things. Even though it's only 20 degrees out, say in January, you start taking your antihistamine, your nasal steroid, start doing your nasal saline washes just to try to get ahead of this. But now that we're in full force of these symptoms, you got to be on those medicines now. And if you're not, you want to come and see your doctor and get evaluated, make sure we're on the right path and get you the right medicines to start taking.
For the people who might be reluctant, pushing it off, I'll be fine. What kind of life-changing results have you seen when someone gets it professionally looked at? They go talk with you, maybe you refer them to a specialist. What kind of process is that like, and what kind of results do you see?
Yeah, absolutely. I mean, it's a big change. It can be a game changer for a lot of folks as far as most of what we see is fatigue, headaches. People are missing work. People are missing out on enjoyed activities. They can't go biking or walking or even going outside to enjoy a beverage, on your front porch with your neighbors or your friends because of the allergies. Once you start getting on these medications and get better control, you're able to enjoy, and you're also able to work and not miss those work days, and not use up your PTO and that kind of thing. For some folks who have symptoms year round, we ask them to come on in and actually get tested to see if they might benefit from what's called immunotherapy. And this is where we actually give injections to try to get your body's own natural immunity to fight these antigens, these allergens, so that you don't need to use medication now. But that's not something that works overnight. That's something you have to get on now. If you started allergy shots today, we might be able to help you with your molds and your ragweeds in the fall, but we won't capture what's bothering you today until next year. So it really is something to think about talking to your doctor about today, as well as year round. But now's the time because it's on everyone's mind and everyone's symptomatic with it.
Symptomatic being the key word there, and especially this past week after the rain, I know that's certainly going to have an effect. So go talk with your doctor. Go see Dr. Gerson, his colleagues at Sherwood, or just call the Baptist Health Helpline. The information is on your screen. All the resources available at baptist-health.com. Dr. Gerson, great to see you. We'll see you in studio hopefully next time. Take care.
All right. You take care, too.